This video will cover monoclonal gammopathy of unknown significance. Alright, this one requires some pop culture, but I really think that most people will be familiar with it. Do I even need to tell you who this legend is? Okay, fine, this is Gus. Gus will anchor us to Mgus, since they sound alike. Before we jump into some more specific diagnostic things, let's appreciate that he looks a bit older than what he was on the show, right? Well, I did this to represent the fact that about 3% of adults over the age of 50 and about 5% of adults over the age of 70 are expected to have Mgus. And he looks to be right in between that age of 50 and 70. Take a look at his shirt. It's very much like him to participate in these charitable activities to disguise his own illegal stuff. The 10% on his shirt for us represents one of the diagnostic criteria for Mgus, which is less than 10% of plasma cells in the bone marrow. The next part of his shirt that is incentivizing people not to eat crabs represents, of course, another diagnostic criteria of Mgus, which is that patients should not have the crab symptoms. In other words, these patients should have normal calcium levels, normal renal function, no lytic bone lesions, and no B-cell neoplasm. The last diagnostic criteria for Mgus is that these patients need to have a monoclonal gammopathy of no more than 3 grams per deciliter. This is represented by this advertisement here in his restaurant saying that each serving of their chicken has 3 grams of protein.